Hello, I'm Kevin Berger. Did you know that your phone could save your life? Not only by making a 911 call, but by sending a text if you're having a mental health crisis. The Minnesota Legislature authorized $46 million in funding for mental health services, and $1 million of those funds was allocated for Text for Life, operated by Canvas Health. The Text for Life Center is staffed with trained counselors and is equipped with software for multiple simultaneous conversations. Here to tell us more about the service is Mark Kuppe, CEO of Canvas Life. Welcome to Newsmakers.
Thank you.
So how does it work exactly?
It's just like any other texting process. Someone who is in crisis is able to take their phone and text the word life to 61222, and as soon as they hit the button, they will be sent to our call center and they will have a crisis counselor in response to that text.
Now, in the past, I know there have been phone lines, the suicide line, the hotline, the crisis line, where people would talk to someone on the other end. Does this replace this for the people who are choosing to use texting instead of the telephone?
It does, and in most cases what we're understanding is these people were not accessing the crisis lines before anyway. So this has provided an opportunity and a new access point for many people who haven't reached out in crisis before.
So who's reaching out?
Mostly right now we're seeing adolescents and young adults. That's the main population that would be texting, although we did see an increase in people over 22 of about 30% in this past year.
And it's just because that is the way they communicate?
It is the way they communicate. Teens do not call. They don't talk to their parents. They don't talk to me that way. They'll text me, but they won't call. And it's the same thing when they're in crisis.
Now, are there limitations for the person who is responding to the text, the trained professionals? I would think that, you don't hear tone, you don't even know if you're talking to a male or a female.
It is an experience in which we have to train people to pay attention to certain nuances. But when a texter texts in crisis, one of the first things we do is we ask them if they would be willing to give us their name and their zip code and what gender they are, so that we can get some kind of flavor of who they might be and what the issues might be for them.
So how many calls or texts, how many clients, I guess, have you worked with now?
We've had over 3,000 some texts in 2013 and over 5,000 in 2014, and that translates to about 2,800 to 3,000 individual texters.
We hear that the mental health system is quite backed up and a lot of people are having trouble accessing it. There just aren't enough people who are there to help. Does this ease some of that backlog a little bit?
It does. It provides immediate access for people, especially people in rural areas who would maybe have to drive an hour to get someplace. Now they can get a response very quickly and very easily just by their phone.
Now, I know that you mentioned that there are trained practitioners on the line. Is there a role for volunteers in your work?
There is a role for volunteers. We'd love to have volunteers come and work with us. They'll go through 60 hours worth of training as part of that process, and they would both work in our call center as well as our tech center.
And do you believe that this work has actually saved lives?
Yes, I do. The anecdotal data that we're getting from that is that people are saying, yes, you have saved my life, you've helped me tremendously. Parents have done the same in terms of response for when we worked with their children.
And Health Partners is involved with this as well. What's the role of Health Partners?
Health Partners made an investment in us to try to broadcast this statewide so that we do it, and we started out by putting billboards throughout northern Minnesota to expose the Text for Life to make sure people understand it's available to them now statewide.
We want to let people know how they could get in touch if they or a loved one could find this helpful. If you're involved with a mental health crisis, go to Text Life to 61222. And if you'd like to learn more, you can go to txtforlife.org if you'd like to volunteer or learn more. That's it for this edition of Comcast Newsmakers. I'm Kevin Berger. Thanks for watching.